Hello, good afternoon. Thank you for attending today's session, Brain Injury Basics, a refresher and research updates. My name is Allie Martin. My pronouns are she, her. I am a certified brain injury specialist and NeuroResource Facilitator with the Brain Injury Alliance of Iowa. And with that, we'll go ahead and get started here. A couple of disclosures before we get started. The development of this presentation is from the Brain Injury Alliance of Iowa and funded through the Brain Injury Services Program of Iowa through Contract 5882B106 with the Iowa Department of Public Health. The development of this presentation was supported by grant number 90TBSG0018 from the Department of Health and Human Services, Administration for Community Living, AOD Traumatic Brain Injury State Demonstration Grant Program. The contents are the sole responsibility of the authors and do not necessarily represent the official views of DHHS. And finally, the content of this presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard in this presentation. Our objectives for this session: Brain Injury 101, the impact of brain injury, optimizing service interactions, and then briefly, we'll look at some up-to-date research. So what is brain injury? There is acquired brain injury or traumatic brain injury. Also noted on here, concussion, which isn't always connected or seen as a brain injury, but it is in fact a mild traumatic brain injury. An acquired brain injury, this is the one that occurs at a cellular level after birth. It can cause cognitive, physical, emotional, or behavioral impairments. So these are going to be caused by things like stroke, near drowning, aneurysm, tumors. Traumatic brain injury is going to be all about the physics. So these are the ones caused by energy transfer or an acute event when an external force injures the brain. So this is a blow, jolt, fall, maybe motor vehicle crash, a blast, shock waves. So looking further, some causes of non-traumatic brain injury, again, tumors, also blood clots, strokes, seizures, toxic exposures, infections such as encephalitis, meningitis, lack of oxygen to the brain. So if there's an airway obstruction, strangulation, perhaps with intimate partner violence, cardiopulmonary arrest, carbon monoxide poisoning, drowning, and drug overdose. One that is definitely becoming more prevalent and researched, and we'll touch on a little bit later, is COVID-19 and how that impacts the brain and can in fact cause some injury to the brain as well. And then looking further into traumatic brain injury. So there's two types of traumatic brain injury: a closed brain injury or a penetrating brain injury. Excuse me. So your closed brain injuries happen when there's a non-penetrating injury to the brain. So no break to the skull, but typically caused by rapid forward, backward movement, shaking of the brain inside the bony skull. This results in bruising, tearing of brain tissue, and blood vessels. Whereas a penetrating brain injury, also known as open head injuries, happen when there's a break in the skull, or just as it sounds, something penetrates the brain, such as a bullet. So this is a couple just nice visuals and further explanation looking at what happens during a TBI. So as mentioned, when there's a force or impact, there's kind of the back and forth movement within the skull. The brain is going to kind of gyrate, shake around. It is very bony in there. So that movement is what's going to create the bruising, the tearing, shearing, and then that causes diffuse axonal injury. So the shearing, tearing of brain's long connecting nerve fibers that happens when the brain is injured and it shifts and rotates inside the bony skull. So that's just a quick visual, what's known as Coupe, Contra Coupe injury. So again, this is when the brain just kind of bounces within the fluid of the skull. So there could have been an impact to the back of the head, but then the bounce forward might also cause some damage and bruising to the front of the brain as well, in the frontal lobe. The frontal lobe is in closest proximity to the skull, so it's not uncommon to see the Coupe contra Coupe injury.
Diffuse axonal injury, or DAI, is caused by the combination of acceleration, deceleration, and contact forces. Unlike hematomas and hemorrhages, where the brain damage involves bleeding, DAI affects individual nerve fibers. Nerve fibers are composed of a neuron body and an axon. Nerves function by sending signals from the neuron body down the axon to other nerves. When acceleration-deceleration forces are great enough, they produce a shearing force that severs the axons of nerve fibers, disrupting nerve communication. This disruption causes nerve cells to die and produces swelling in the brain. When the brain swells, pressure in the skull increases and can lead to complications such as restricted blood supply to the brain tissue and brain herniation.
So again, just a couple nice visuals there that give a little bit of a better look of what is happening during a TBI.
Diffuse.
So then how do we mark the severity of injury? So typically severity of injury looks at loss of consciousness. So mild traumatic brain injury or perhaps concussion might be a brief or even no loss of consciousness. Moderate is going to be marked by unconsciousness, neurological signs of brain trauma. There may be findings on the scan. Severe is marked by a period of loss of consciousness of 24 hours or more. Now looking at Iowa specific, what are the causes of traumatic brain injury in Iowa? The leading cause and what continues to be is actually falls at about 66%, followed by motor vehicle accidents, 21%, unknown cause at 8%, assaults at 3%, and then strike or blow at 2%. Definitely with the falls, it is certainly more common as well in our aging population, so individuals over the age of 75. But certainly falls don't discriminate against anyone, hence it being the leading cause for traumatic brain injury. And then just a little further looking at the data of brain injury. So it's estimated about 17,000 TBIs occur in Iowa annually. And that means approximately 15,000 emergency department visits, 2,500 hospitalizations for TBI annually. And then as a result, 95,000 Iowans are living with long-term disabilities as a result of brain injury. And then beyond Iowa, looking nationally, acquired brain injury is actually the second leading cause of disability. So again, acquired brain injury are going to be those non-penetrating, so stroke, aneurysm, infections, toxic exposure, etc. So why does all this matter? There's definitely intersect in a lot of different areas with brain injury. So some of the most notable mental health, serious mental illness, and substance use disorders and criminal justice. So when we look at this here, the blue is going to be individuals with a brain injury. The purple is going to show in comparison to general population. So we see, especially with serious mental illness and substance use disorder, definitely one of the leaders with multi-occurring conditions, where there is a very high rate of at least a history of one traumatic brain injury. So looking a little bit further, research indicates 34 to 49% prevalence rate of mental health conditions in individuals with brain injury. And this is compared to about 18% rate with the general population. And again, why is it important? What can we do about that? Treatment professionals need to be aware of the history of BI individuals. This is important, screen for TBI upon intake, coordinate an effective treatment plan, creating a multidisciplinary team with providers that are specialized and knowledgeable of BI. And then again, substance use disorders, definitely even a higher correlation here. So drug overdose causes individuals to receive a lack of oxygen to the brain, what's known as hypoxic brain injury. So again, when we were discussing briefly what acquired brain injury is, this would certainly fall within acquired brain injury, those hypoxic injury from overdose. 72% of individuals in a dual treatment program for substance abuse and severe mental illness, again, have reported at least one TBI. So well over half of the individuals seeking dual treatment for these multi-occurring conditions definitely have that history of TBI as well. And then 20% is the approximate percentage of individuals that begin using substances after an initial brain injury. So substance use disorders certainly can cause the brain injury, but they can also escalate the brain injury or exacerbate use post-brain injury as well. Another one we'll touch on briefly, brain injury and homelessness. So individuals who are homeless are up to 5 times more likely to have sustained brain injuries compared to general population. And it's important to note that majority of homeless adults with reported TBI history sustained injury prior to becoming homeless. So when we think about this cycle and kind of connection of TBI and homelessness, so homelessness risk factors, there's definitely increased likelihood of assaults, elevated substance abuse. Those then, of course, increase risk for TBI, and then TBI risk for becoming homeless. Perhaps there's a decreased income, decreased social support. So there's definitely, like I said, a large connection with TBI and a lot of these different special populations. So why is there the intersection of these multi-occurring conditions? Brain injury affects people on a lot of different levels, and it affects people differently. TBI can affect you physically, chronic headaches, dizziness, chronic pain, decreased coordination, balance, sensory limitations, cognitively, difficulty with self-monitoring, difficulty with initiation, sequencing steps. They might have memory impairment, impairment with attention, inability to remain on task, difficulty focusing on thoughts, maybe just collectively deficits with language, visual perception, and then of course, behavioral and emotional. So increased frustration, irritability, restlessness, high prevalence of anxiety, depression, low self-esteem, disinhibition, difficulty with emotional control, and even personality change. And so when you think about all of these different effects of brain injury, we could see how someone that's maybe struggling with behavioral outbursts, also struggling with self-monitoring, maybe initiation, attention, memory. This is definitely gonna hinder things like maintaining a job, maintaining housing, mental health stability, not utilizing substances, if there's maybe that impaired judgment. So definitely, again, notable that there is an intersection with a lot of multi-occurring conditions, because there are so many different effects that can happen due to brain injury. So taking that a step further, trying to just connect brain behavior relationships. So not getting too deep into it, but just kind of a brief overlook at what parts of the brain are going to control what behaviors. So as mentioned, the frontal lobe is in closest proximity to the skull. So if there is that Coupe, Contra Coupe injury where, perhaps you were hit in the occipital lobe, but there was kind of that gyration and movement of the brain, it can then cause some inflammation damage to perhaps the frontal lobe. Frontal lobe is where our problem solving occurs, our emotional traits, reasoning, voluntary motor activity, judgment, and really just a lot of our executive functioning. Temporal lobe, hearing, understanding language. The cerebellum is going to be balance, coordination, that fine muscle control. And then occipital, vision, color perception. Parietal lobe, knowing right from left, sensations, reading, body orientation. And so injury can certainly occur predominantly to one area of the brain. It can be local, it can be more kind of all without the brain. So it's sometimes knowing where the injury occurred can kind of help to make sense of the brain behavior relationship. So again, how do we know if they've had a brain injury? Why is it important to know if they've had a brain injury? We've covered, definitely all of the consequences effects brain injury can have, and then of course, how that's going to intersect with other multi-occurring conditions. So it is important, especially if you are a provider and one of those special populations, that we're doing a lifetime history of traumatic brain injury screening. And so the screening investigates the potential of maybe a prior injury. It is noteworthy that it's not a diagnostic tool, but it certainly gives you an idea of if an injury might have occurred, or if they even know that injury did occur and it was confirmed. So it's just 4 basic questions. We do have a session going on as well that dives a little deeper into this. So I'd encourage you to check that out as well if you want to learn a little bit more about the screening tool in particular, and again, why we would want to use it. So another tool use, and this is a functional assessment, specific and validated for individuals with brain injury. So it's called the Mayo Portland Adaptability Inventory. Reasons to consider the Mayo Portland, it's really going to look at neurocognitive impact. So looking at emotional change, behavioral change, social change, physical change, and cognitive changes. So once we have a better look at this, we can assist in clinical evaluation following acquired brain injury. It can assist in evaluation of rehab programs. It assesses obstacles to community integration. And it assists with understanding the cognitive and behavior disabilities resulting from brain injury. So again, specific to brain injury gives you a better picture of, symptoms, effects of their brain injury and how that's impacting other parts of their life, which can be very important when looking at accommodations, service planning, to make sure that we're addressing the changes that are found with the Mayo Portland. So accommodations, what's it mean to accommodate? Provide services in a manner that takes into consideration the special needs of an individual. So brain injury has been referred to as the silent epidemic or the under-recognized relationship. It's often the missing link to positive outcomes for multi-occurring conditions. So I love this graphic over here, the iceberg. So what you see, you look fine. Brain injury can certainly be often misunderstood. It's not always physical. It's not an injury that people know you have. And like I said, it affects everybody differently. So the things people don't see or don't understand or connect to the brain injury are things like chronic fatigue, headaches, difficulty processing, memory problems, coordination, again, that emotional stability, emotional regulation, personality changes, sensitivity to noises, impulsivity, irritability, confusion. So definitely all things that can certainly be misinterpreted, misunderstood, if again, you look just fine on the surface, but not knowing really what's underneath. And in fact, that could be brain injury. So why do we create accommodations? Providing accommodations creates an opportunity to address potential barriers to treatment success. Again, there can definitely be the misinterpretation of symptoms of TBI by treatment providers, caregivers, family, friends. For example, maybe we label an individual as non-compliant, or they're resistant, or they're just not participating in their treatment program. When if we look a little bit further, perhaps they struggle with mental inflexibility. They're struggling with language processing, attention, memory. They're not getting good sleep, which is leading to chronic fatigue. They're lacking organization. They have just that impaired self-awareness, and maybe they don't totally understand that that is a problem going on. Struggling with processing, again, impulsivity, physical and sensory motor. So these are definitely some common deficits that can occur with brain injury, and then accommodations that can be made. This is part of our accommodation tip sheets we have here at the Brain Injury Alliance of Iowa. Just kind of a basic accommodation for individuals with brain injury to keep in mind. Rowboats, so reducing amount of information, one instruction at a time, written and verbal when possible. Breaks are helpful, often is better, routines help. Ask a person for paraphrase or repeat. Take time and go slowly. Simple and organized info is best. And of course, this isn't a one size fits all, but definitely things to keep in mind when making those accommodations for individuals if we know there's a brain injury or particular deficits that they're struggling with, finding the tools that can help them to better succeed in the program and then overall have a better outcome. So here's one of the examples of the tip sheets like I was talking about. So for example, organization. So organization, the ability to use time, energy, resources, and an effective way to achieve goals or complete a task. So if someone's struggling with organization, some things we want to look for, maybe they're late for their appointments or they're missing deadlines. And they have difficulty remembering scheduled tasks. They're inconsistent with their medication management. They have, seems like, inability to track date and time. They challenge or have challenges attending to one task at a time, or maybe even completing a task. Again, maybe someone's late for appointments or missing deadlines. It can certainly be misinterpreted if they didn't know, perhaps organization is what this individual is struggling with. So how can we better accommodate that versus misinterpreting as non-compliant? Suggestions like using a notebook, a planner, use of digital calendar or reminder apps on their phone or watch to manage their schedule. So there's definitely, assistive technology has come a long way, especially with smartphones, tablets. All of those things have certainly increased opportunity for organization, reminders, help with memory, medication management, things like that. It's important to review appointment dates and times with that individual at the end of each meeting. So not just assuming that somebody knows when the next appointment is, but again, often is better. So explaining again when the next appointment is, having them repeat it back to you. Trying to schedule reoccurring appointments on the same date or time. Again, consistency is key. If they know that every Tuesday at 10 a.m. they have this same appointment, it's certainly going to help them with remembering, organizing, to be more consistent with that appointment. And when we're trying to help individuals transition between meetings or tasks, using a timer or giving a verbal warning. So in some treatment settings, you're going from group to group. So just letting the person know, prompting them, you have 5 minutes to get coffee before group starts. Give them that moment to kind of process and transition into the next meeting. And this one is important in a lot of different aspects. So breaking down tasks into smaller, simpler, realistic steps and encouraging them to cross them off as they're completed. So ways to learn more. Hopefully we've learned that being brain injury form is important. It's definitely prevalent in a lot of different industries. And like I said, affects people in a lot of different ways. So better understanding brain injury. At the Brain Injury Alliance, we offer monthly educational opportunities, and then of course events like our annual conference here. But on our YouTube page, several videos, including things like concussion, domestic violence, interpersonal violence, support for caregivers, which we know is very important, not just for brain injury survivors, but the other individuals that are in their life. More about brain injury screening. Again, that connection of substance use disorders and traumatic brain injury. Looking at employment after brain injury, chronic pain, and of course, several others that I would encourage you to check out. Okay. So we're not going to get too far into this. It could certainly be a session on its own. Again, the goal is just really to get kind of a basic understanding of brain injury, hopefully capture the importance of understanding brain injury, understanding when an individual has a brain injury, and just making those connections. And again, kind of bringing to surface this under-recognized relationship. Research has come a long way with brain injury, and just a couple of notable things wanted to highlight here. The FDA has approved the first blood test to evaluate for mild traumatic brain injury. Again, mild traumatic brain injury can be, concussions, not necessarily losing consciousness. And with those, it can be hard to capture just on a CT scan. So this blood test is known as the brain trauma indicator. It measures levels of 2 protein biomarkers. I'm not even going to try to pronounce all of those. I'm confident you can all read that. But these proteins are released from the brain into the blood within 12 hours of head injury. So levels of the blood protein after mild traumatic brain injury can predict which patients may have intracranial lesions visible by CT scan and which won't. So a couple things notable here. First off, within 12 hours of the head injury. So of course, it's important to seek medical attention if there is, possibility of any sort of mild traumatic brain injury. And then also just looking at the blood detecting these proteins. So the blood is really showing more than, at times maybe what a CT scan isn't capturing right away. So definitely cool advancements coming with brain injury detection. And again, just one that wanted to notate and hopefully continue to follow and see what more comes from that. Most relevant here, certainly been the conversation within the past 3 years of this pandemic. COVID-19 has resulted in an array of chronic neurological, neuropsychological complications, so including mental clarity, brain fog, concentration, attention, memory, headaches, anxiety, depression, even increasing risk and causing stroke. Of course, here at the Brain Injury Alliance of Iowa, we've been following all of the kind of emerging research, best and promising practices to address chronic COVID, known as long COVID, originally long haulers, post-COVID conditions. Again, now kind of leaning more towards what's known as chronic COVID. So those individuals that, even 6 months after initial infection or perhaps overall seem to have gotten more healthy since time of infection, are seeing kind of these long-term effects. And again, specifically here, we're really wanting to follow and focus on the neurological, neuropsychological complications to better support Iowans that might be experiencing this chronic condition. So research, definitely has changed by the day, continue to learn more as different research is conducted. So efforts definitely are continuing to try and identify the exact pathophysiology of the chronic symptoms. But here are some things that we for sure know to date. Prior assumptions were that the virus was directly affecting the brain cells, but this has actually been disproven. Nervous system injury is likely a result of severe inflammation and neurovascular injury. And so a lot of the most recent research that's out there is more indicating the damage and neurological effects are coming from the severe inflammation that's happening. So when we looked at, for example, diffuse axonal injury, we know that inflammation, swelling of the brain can in fact damage the brain. So having that severe inflammation in response to the infection is certainly causing some damage to the brain. So neurological insult from SARS-CoV-2 infection could increase incidence and severity of neurodegenerative diseases, such as Alzheimer's and Parkinson's disease. So again, looking more to what are the long-term effects of COVID-19 for individuals that are kind of having these chronic neurological symptoms. There's definitely a connection, with neurodegenerative diseases. Research also suggesting that the mechanism involved in COVID-19 brain damage may resemble those in traumatic brain injury. So in such injuries like seen in football players, again, key thing is noting the inflammation and injury to the blood vessels in the brain, which are resulting in loss of neurons. So a lot of stuff is coming forward here with the research. Again, it's ever-changing, is certainly something we're following here, but worth noting the long-term impact it has, especially for brain health. And just a list of references here. And my contact information. Again, my name is Allie Martin, NeuroResource Facilitator with the Brain Injury Alliance of Iowa. Please feel free, if you'd like any of the resources or information shared today, to reach out to me directly. You can also contact Brain Injury Alliance at info@biaia.org. I'm certainly open to any questions, so feel free to share those now, or again, you can reach out after this presentation. Thank you all so much again for attending. Take care and have a great rest of your day and great rest of your conference.
Hello, my name is Brandy Jensen, and I am the Director of Programs and Services with the Brain Injury Alliance of Iowa. Thank you for joining our annual conference this year. I'm going to take some time today to just talk a little bit about the services and supports that are offered through the Brain Injury Alliance of Iowa, and help you understand what sort of support and resources our staff can help you and families with in your journey after brain injury. So our mission here at the Brain Injury Alliance of Iowa is creating a better future through brain injury prevention, advocacy, education, research, and support. And I'm going to talk a little bit today about how the different services that we provide really meet that mission in a variety of ways. So this slide gives just a quick sort of menu of the different programs that we offer. And we're going to talk a little bit at length around each of these different points on this menu. But the biggest one to really know and understand as our core service is our NeuroResource Facilitation program, which I'll talk about first today. You'll see that we offer some resource tote bags. We have a network of service providers as well that provide information to constituents across the state through our Iowa Brain Injury Resource Network and Stroke Resource Network. We do some training and education around the year. And we also offer a variety of support groups and case consultation opportunities for professionals and families, in addition to a lot of advocacy as well. And so let's talk just a little bit today first about our NeuroResource Facilitation program. And so what this service is a statewide support that we offer through our staff. We have a team right now of 5 individual facilitators, NeuroResource Facilitators, we call them NERF staff, who have caseloads of individuals that are family members, individuals with brain injury, caregivers, and they help these individuals and families with the needs that they have in their life that are results of brain injury, whether that is complex behavioral needs and helping them get the services and supports that they need to meet those needs. It could potentially be helping them understand different resources and programs that are available for their employment, vocational goals, and understanding then systems and services that are more at the public funding level through statewide programs that exist here in Iowa, like the brain injury waiver, or federal programs like Social Security, disability, and that sort of thing. We help individuals navigate through those different systems, the different steps for different programs, and really are a partner in their journey after their brain injury. So as you can see on this slide, there's a lot of different systems and programs and entities out there that are very complex to navigate for someone. So if you have an individual that is a person with a brain injury, or even a family member of a person with a brain injury, these systems are extremely difficult to navigate, and family members oftentimes are thrown into this system very quickly as compared to perhaps individuals with disabilities that result from long-term illnesses like, perhaps cancer or heart disease, where they've progressively had time to explore these programs and make sense of these. Where an individual with a brain injury, a lot of times it's a very sudden change in their life, and they are required to make decisions very quickly and understand their options that they're facing very quickly. And so it's helpful to have someone that is familiar with these services and funding streams and programs just to help make those decisions. And that's the type of work that our NeuroResource facilitators help clients work on every day. We have staff that take new cases and existing clients based on the region of the state that caller is in. So they all have the ability to work with someone that's familiar with the programs and resources that are in the area that they're living in. That is the main goal of NeuroResource Facilitation as our large core service that we offer that's funded through the Department of Public Health. But as you saw on the first slide, we have a variety of other things that we offer as well. Our resource tote bags are really our signature piece of written information and resources that we provide to families and individuals with brain injury and professionals across the state, including the members of our Iowa Brain Injury Resource Network and our Iowa Stroke Resource Network. These are really the starting point that we want people to have access to, that includes a lot of very basic information to help them understand brain injury as they're dealing with it with their own family, terminology, coping skills, those sorts of things, in addition to programs that are out there and available for people that are navigating this new world. So, employment goals. So, the voc rehab world, for example, understanding the brain injury waiver and what that is and who's eligible and what kind of support is that going to provide to my loved one. So 14 or 15 pieces of information go in these bags. We have several different specialized tote bags as well. Right now, we've got some that are available for adults and pediatrics separately. We also have some that are customized around stroke, specifically substance abuse and brain injury. And then we also have a tote bag that's focuses on those individuals with complex behavioral needs that are in the community neuro rehab settings here that are unique in Iowa. So if you're interested in getting some of those materials, let us know. You can reach out to us and we can send you those or help you understand what is in each of those by taking a look at our website on our resource page. That's all laid out there as well. We also have the ability to do case consultations with providers and professionals and family members as well, when there's specific or unique or complex issues that might be going on around that individual and their needs. It's very helpful. We've found over several years to bring a lot of different minds to the table to troubleshoot and brainstorm those solutions for the different needs that people with brain injury have, whether it's employment focused, behavior focused, housing. There's a variety of things that can be complicated and hard to manage, if it's not something that you're used to or understanding of what specialized services are available in Iowa, we can help kind of navigate all that and bring everybody on the same page for some solution-focused meetings. And we've found that that can be very helpful. So we have those available to professionals and families as well. Those are completely free and part of our mission. We do a variety of training and educational opportunities throughout the year. Obviously, we have our annual conference, which is you're a part of right now through this virtual setting. We're very hopeful and confident that next year we'll be able to bring this event back to an in-person event. And so stay tuned for that. Over the next probably 6 months, we'll be able to have some information announced on that. And then we also do a variety of webinars and educational pieces throughout the year that really just hone in on different topics that are relevant to brain injury. So we'd love to hear from you if you have ideas and things that are popping up as a common theme that you'd like to hear from some experts on. And so, I mean, this is just a snapshot of some examples of different topics that we've done and can do more of. But we do webinars that are specific to the needs of professionals and providers, in addition to some webinars that are really honed in on those needs of the individuals with brain injury and their family members. So I'm always looking to hear new topics from you on what you might want. Here in Iowa, there are some options for some formalized brain injury training for professionals and service providers in the state of Iowa. Several of you might be familiar with this as part of your work that you do, and perhaps even some requirements for some of you in the service world. But the first of these is really what the Department of Human Services here in Iowa offers. It's on their website, and it's some specialized brain injury training modules that are part of the training process for brain injury waiver HCBS service providers to have done, in addition to some other service providers. Those are in the process of being revamped and refreshed over the course of the next year. You'll see that there'll be a newer version of those coming out. There's also a program that is owned and operated through the Brain Injury Association of America called the Academy for Certified Brain Injury Specialists. And that is a training and a certification both. And so several of you might be familiar with that. We frequently host trainings for that particular certification. We have 2 professionals on staff that are certified trainers for that program. And that does involve a textbook that you are responsible for reviewing, going through a training, and then sitting through a certification that is offered through an exam through the Brain Injury Association of America. The Brain Injury Association of America also offers a smaller content training, more directly focused on the needs of direct care staff and what they really need to be serving individuals on that level of direct care. That's called the Brain Injury Fundamentals program. And we also have staff that are trained to provide that training. And we do have a training coming up for that program in April. We would encourage you to consider that training. It's coming up the first, second, and third week in April. It's once a week for 3 weeks, a 3-hour session, and we're offering a free some free registrations for that through our exhibit here on this webinar, here on this conference. And so I would encourage you to take a look at our exhibit area and sign up for the giveaways. To possibly win a free registration for one of your staff for that brain injury fundamentals training. We do also have a variety of support groups across the state here in Iowa. Unfortunately, the large majority of those have not been able to meet in person as a result of COVID-19 over the last 2 years. However, we have a very robust virtual support group that meets weekly. That is one of the best things that came out of COVID-19 for our organization and for the people that we serve. That group continues to meet, will continue to meet Thursdays at 3 o'clock. And we also have a couple of specialized kind of special focus monthly virtual groups that are scheduled on a monthly basis as well. COVID-19 Long Haul is one of our monthly groups, and we have a caregiver group. And we're also in the process of kind of getting our ducks in a row for getting the support groups across the state back in person. And we'll have more information about that coming very soon. So those groups will be able to start meeting back in person for the summer. So more information on that coming very soon. And then really the last piece of work that we do through the Brain Injury Alliance that is such an important piece of the work that individuals with brain injury and their families need is advocacy. And we're involved in advocacy at many levels here at the Brain Injury Alliance of Iowa. First and foremost, in that direct support stage with individuals that are, they are in those situations where they need someone to be on the phone with them, making calls to appeal decisions that are made from different entities in their care, whether it's managed care organizations or hospital situations, insurance decisions, that sort of thing, to housing situations, landlords, or perhaps even employment. If they're in situations with their job or their employer, and they're needing advocates to help through those different situations that are occurring as a result of their brain injury. So that level of advocacy is going on every day with our staff on the phone with clients, really in the trenches. We are also involved really in that system and legislative level of advocacy through a variety of methods. One of them being kind of the key first step for that level is our annual needs assessment that we do here, that is currently open right now for feedback. We have an online survey. If you go to our website or our exhibit box here on this conference, you will see a link to the annual needs assessment. And these are questions that are designed to really gauge the areas in system delivery and awareness around brain injury in the state of Iowa, what's working well and what still needs improvement. It's very important to hear from you on that survey, and the responses on that survey really inform the decisions that are made in the state of Iowa to build plans for advocacy at the large system level, in partnership with the Advisory Council on Brain Injuries, then the Iowa Department of Public Health. That feedback informs what gets put into the state plan for brain injury. And so your feedback is crucial in that level of our feedback forms that we offer. So if there's questions or ideas that people have that they would like to discuss, you can put those questions or comments into the chat box. We'll have some time here, hopefully, for some questions to be answered after the session is over. Thank you so much for joining us today. Our contact information is here as well, so you can jot that down.